Hi, my name is Mako Mori-Khan, and today I'm going to be talking about my literature on the psychological impacts of acne on adolescents. So, a little bit about myself. My name is Mako. I'm currently a sophomore in high school, and I'm interested in many fields, including dermatology and psychology, and much more. So, before I talk about the literature, I wanted to discuss what acne vulgaris is and mental disorders that come with it. So, acne vulgaris is described as a condition where oil glands can become clogged by bacteria, increased production of sebum, and unusual function of keratin. Adolescents can experience 6 different types of acne, including blackheads and whiteheads, which are oil glands that are filled with oil and dead skin. Pastoral and pustule acne can appear red and tender and have a white bump. And cystic and nodule acne are more severe types of acne that might need treatment, like topical or ointments. So, what is depression and anxiety? So, depression is defined as a disorder that can make a person feel sad and unhappy, and anxiety is defined as a feeling of fear and unrest. Both of these disorders can be long term and may not be temporary, and many adolescents experience this because it's a stage where the adolescents experience hormonal changes and other changes in their social life. My question was, how does acne vulgaris affect adolescents' daily mood? And my hypothesis was that acne vulgaris is likely to have an adverse effect on adolescents' daily mood, causing different mental disorders as well as negative impact on activities adolescents do in their daily life, such as school and sleep. So these first 2 studies were cross-sectional studies. The first one um, focused on the quality of life on people who had acne. And in this research, there were more girls than boys, with 134 girls and 115 boys. And the researchers used different questionnaires and indexes to get information from the patients. From the results from the Children's Dermatology Quality of Life Index, it showed that there's a big difference between results of girls and boys. And this may be because the girls experience more change in their mood because of, or which could lead to less confidence, as well as feeling emotionally affected for a long time. Another study focused on the relationship between sleep, mood, and acne, and the researcher also used many different questionnaires and indexes. They used an S anxiety subscale and T anxiety subscale to assess the anxiety in the present and current time. And the high scores from these questionnaires and indexes showed that the adolescent experienced anxiety from poor sleep, and this was significant because it showed that the adolescents were in a cycle where they would have poor sleep, which could cause more anxiety, which would most likely lead to them experiencing more acne. Another research was focused on the acne's effects on adolescents' well-being, and this research had 1,329 participants, and they were in the age range of 15 to 30. These participants struggled with their well-being as well as confidence and mental health. And from the results from the questionnaire, women were most seen to conceal their acne with makeup and experience more psychological discomfort, while men experience more physical discomfort. Another research was done with isotretinoin therapy, which is commonly known as Accutane, and the patients in the study were in the age range of 12 and 19 and were from urban or suburban hospitals. The patients had a choice of using 1 milligram of isotretinoin therapy or maximal conservative therapy, which would include topical antibiotics, oral topicals, and topical retinoids. In the study, the researchers learned that the isotretinoin improved depressive symptoms and would help the patient's overall mood as well as their daily life. The next study was focused on acne vulgaris' effect on adolescents in school, and the study was done in Saudi Arabia. In this study, excuse me, the patients were also in the age range of 12 and 19, and the results from the questionnaire that was given showed that 7.2% of adolescents had a very high score, especially among women. And it was most likely because the females would compare themselves and they would also focus on a lot on beauty. The researchers also stated that the adolescents were not educated a lot about what acne was, and 31.2% of the participants considered acne vulgaris as a disease, while 80% classified it as a curable dermatitis. So, acne vulgaris can lead to some long-term effects. With depression, a patient had discussed how they had acne when they were 15 and now they're 22 years old, but they never had psychiatric treatment but felt that they experienced depression. They explained that they would compare themselves in their mirror and felt overwhelmed often. Another patient who was 22 years old explained how they felt hopeless with skincare products and they would never work and wouldn't go to school because they struggled with their confidence and would also feel uncomfortable when they would have to go to job interviews. With lifestyle, a patient felt embarrassed because they had acne on their face, especially when they were playing sports or working out. And another patient explained how they felt that they had a connection between acne and eating, and they would avoid certain foods that had lots of sugar, like candy and chocolate, and would often feel embarrassed when they bought certain items from a grocery store, including ice cream, because they felt that people would judge them for buying that specific food because they had acne. They also stated that they felt jealous towards people who would eat the same types of food that had sugar like candy, but would never have to experience acne. Thank you for listening. And in conclusion, acne has many psychological impacts, and people should spread more awareness about the negative effects of acne among the adolescents.
Okay, thank you so much, Marco. That was a very informative and insightful presentation. Now, let's take a couple of minutes for any audience question. Feel free to drop them in the Q&A box. Okay, while we're waiting for the question, I have a question. So, what inspires you to explore the acne psychological impact?
So I was inspired to do this literature review because
Mm-hmm.
I thought it was interesting how when people would experience acne, they would kind of feel like they could never kind of get cured, and it kind of seemed like acne was something really big. And I personally
Yeah.
experienced this myself, where with acne, I just felt like I could I couldn't do certain things. Like I struggled with um just like feeling confident. And so I just kind of wanted to research on like why that is and how that happens, just to spread more awareness, because I also think that acne is kind of normalized. And I think people should spread awareness more about its significance and how it affects, especially adolescents.
That's true. Thank you. And we have some questions. The first one is, what has been the most unexpected experience during your research?
That's a very good question. Unexpected experience. Um, I didn't, I'm not exactly sure. I feel like Well, I found this one research that had talked about patients' like personal experience with
Mhm.
acne and kind of like with how it affected their family relationship. And it was really
Mm.
interesting because um, the person was stating how like their parents would feel ashamed because the patient had acne, and I thought um, that was really interesting, and I was like unexpected to see that kind of information from someone in the family.
Yes. And then we have another question. Do you think these results would apply to adult acne as well?
Yes, I think these results would apply to adult acne as well. Um, I think with adults, they might have more exposure to different treatments and different information. Um, and especially because with social media, adolescents may not know like what is exactly true and false with information, because there's lots of influencers online who give false information about certain skincare products and certain things that would quote unquote fix acne. And um, so I think that can also um, cause like depression because they can never fix their acne. But I think that adult acne, or people who struggle with acne as adults also um, may feel like depressed and have a lot of anxiety when they're around people, especially because um, as people grow up, their acne may go away, but as an adult, when they still have acne, they might feel um, kind of embarrassed sometimes.
Yeah, that's true. And we're gonna move to the next question. Are there foods that are associated with acne, or is it more like hormonal?
Um, I haven't specifically looked at if there's any foods that are associated with acne, but I'm not like specifically sure, but I just know that um since the adolescents are kind of experiencing hormonal change, that definitely
Mhm.
is a big factor with acne. Um, because the patients can or the adolescents can experience like flare-ups, but then it can like go away and then the acne can come back. And yeah, there's most likely some foods that cause adolescents to um get more acne, but I think it also depends on each person because some people can like eat candy and their acne won't get affected, like how one person talked about that, or one person talked about that in the long-term effects.
Mhm.
But some other patients, when they eat like candy, they get acne flare-ups. So definitely, I
Yeah,
think it depends on the person.
yeah, it depends. Yes. And we have one more question. Have you considered further research into the connection between acne and eating disorders? You make mention of how people refrain from certain food because of their concern of perception by others.
I think this is a very interesting point, and I have thought about this a little bit with kind of like research I would do in the future. And I think this is really interesting because I do think that there's a really big connection between acne and eating disorders. I think from like the from research I've seen, definitely some adolescents will like avoid certain foods because they don't want to experience more acne because they with like the struggle that they already have. And I think that there is definitely a connection between it. And um, I think that's also not talked about as much and I would definitely love researching um, that as well.
Yes. Thank you. All right. Thank you so much, Mako.